So, Dr. Anna, what about inclusions and exclusions for a survey? I mean, do we have any inclusions or exclusions, or is it, everything comes in under the purview of the survey that we are deciding to do? How does it work?
So that's in continuity to what Dr. Suvin just mentioned. When you define the purpose of your survey, your target audience also needs to be defined. So that's where you need to be clear on your inclusions and exclusions. I'd like to take an example to explain better. For example, patient feedback survey. Now, if it is about the hospital, we would include all our patients, right? Because we want to know, we would want to give that opportunity for feedback to all. Ideally, that's how a patient feedback survey should be done, rather than like a convenience sampling, which also we have seen in certain units where we want to hear more good than the truth. But what is always better is we include all the patients. However, if we are looking into, let's say, something only to do with emergency room, or let's say lab or imaging facilities, we would want to include only those people who have experienced that particular service. Right. Now, when we move to other surveys like PROM, for example, I mean, that's also a survey, something of a clinical nature. It's very important to include only those people who come in that criteria of treatment. And sometimes when it goes further, for example, let's say we are doing something regarding acute stroke, we have to include only those patients who come in the window period of that acute stroke. So it depends also on what is it that you want to survey, and those clear guidelines have to be put as your inclusion and exclusion criteria.
Great, great. So then, like we're talking about, deciding the inclusions and the exclusions based upon the purpose of the study. How would you define the target group, Dr. Anna? I mean, yes, so you are saying that basically primarily we'll decide that, okay, for example, acute stroke, how many people are actually coming within the window period, right? So that is how you're deciding on the target group. Is there something else that you would like to talk about, Dr. Suvin, when it comes to, what is a kind of people or patients or stakeholders that you're planning to include in your survey?
I'll take it from where Dr. Anna spoke. In fact, when we talk about audience or the target population, what are we looking at? We are looking at the stakeholders, the patients or the doctors or the physicians or the employees. So we have defined our own target. If suppose we are just looking at how we go about analyzing that, we may have a target population. We need to define a sampling frame or the sampling population, and finally we get what is called a sample. So whether we get the entire population, like Dr. Anna said, it may interest that we may want to get all the patients in the basket for the feedback, or we may target certain segments, certain clusters, where it would be more niche to get those feedback, because that is our targeted audience. So that will work. So you may either have the entire sampling, or you may probably focus on some segmentation, some stratification. Like, I'll just elaborate on one of my examples. If I'm doing a feedback on service satisfaction, I would like to look at how the nurses perceive a particular service provided by one of the supportive services, say laboratory. And I would like to see how the consultants or the junior doctors perceive the services from the diagnostic, because the use by various users are different. The use by a consultant would be different from the use by the nurses. So their perspective would completely different. So if I am going to get the information from both and combine together, I may not be getting the right or the correct interpretation of the information. So I would like to segment it. So just to continue with what Dr. Anna said, I would like to segment some of these feedbacks or some of these surveys.
Great, great.